that is somewhere around 16 weeks, 24 to 28 weeks, 32 weeks, and 36 weeks. So this is important. Next, we have different components. Like we have to talk about antenatal diet. So we should ask her to have a good diet, eat good balanced food. And now this is a 5 marker actually. So the diet during pregnancy has to be adequate, and then these dietary recommendations are just a background. They're just telling us on what kind of, it's basically more of an advice. There's no strict stringent diet plan that they're supposed to eat so and so only. They can have anything, but basically try to conform with the allotted values. Like, so this again, we're basically following balanced diet wherein we want our carbs to be around somewhere between 65%, proteins to be 20%, fats to be the remaining in portion, which is around 20%. Now in fats also, saturated fats have to be less than 10%, avoid empty calories, have good amount of fiber, avoid artificial sugar, have good nutritious food, homemade meals are allowed. So it's basically a set of that itself. So it's just a diet, but one thing that we recommend is she has to have milk. So every day at least 1 liter or half liter of milk with green leafy vegetables, fruits has to be taken, and salt should be enough. You don't have to go for salt restriction unless advised. And basically have a diet which is rich in proteins and minerals and vitamin B12, iron supplementation, folic acid supplementation has to be done. And why is diet so important here? Because she has to maintain her health. She has to provide enough good nutrition for the baby. Growth of the baby depends on this. And she has to build good strength for the process of labor and for successful lactation. And this calorie requirement is 300 kilocalories extra during pregnancy and 350 kilocalories during the process of labor. Now this is very important, and this keeps changing. So suppose somebody who has a low birth weight, so you have to give them more food, like you have to advise them to eat to consume more calories than this 300. Especially somebody who has a high BMI, we advise them to take slightly lesser calories because they are at a risk of developing gestation, diabetes, mellitus, and hypertension. Now another very important point here is that even in the last trimester, if you make good dietary improvements, the birth weight of the baby improves drastically. So that is another very important point. So here there is a table which is talking about dietary requirements of dietary chart in pregnancy. So energy to be taken during pregnancy is 2500 kilocalories, during lactation 2600, protein 60 grams, 65 grams, then iron, zinc, riboflavin. These are all vitamin levels which are not very important to be memorized. And obviously go for supplementation. So we can explain a little bit about the supplementation. Then in antenatal advice, the first part of it was diet. The other things like having good rest and sleep. Then there is a little constipation during pregnancy. Have good fiber food. Drink a lot of water. Regular bathing. Maintaining good oral hygiene. Wearing loose clothes. Don't wear tight belts or tight clothes, especially which are clothes that are tight over the abdomen. Take care of breasts. And traveling in pressurized air chambers, that is airplanes, is contraindicated after 32 weeks. Now immunization, all live viral vaccines are contraindicated. You can give all the passive one. Generally, as per routine immunization, we give tetanus toxoid at 3rd and 5th month. Suppose we have given this before, then we give it at suppose I've given within 5 years, and only one booster dose is advised during pregnancy. And you should take care of minor ailments during pregnancy, that is nausea, vomiting, backache, leg cramps, acidity, burning, etc. These can be managed in a risk-based approach. We are trying to rule out syphilis, anemia, or symptomatic bacteriuria, and take care of that. And then we also have then mentally preparing the mother, and these days we have included preconceptional counseling. So preconception counseling is when a couple is counseled about the course of pregnancy and outcome even before actual conception has occurred. So the objective is that a mother should enter pregnancy with good health, with optimal health, so that it is safe for both her and the baby. So organogenesis is completed by 1st trimester, and hence woman has to see a maximum by this time. After this, if you see a consultant, genetic consultant, it is not going to be very beneficial. Now this can be of two types: either somebody who has not conceived yet and they've come to you for the first time, or it could be somebody who has had previous history of fetal losses, recurrent abortions, or child with anomalies. They themselves have some anomalies. or it could be somebody in the family has delivered a baby which has anomalies. So they can come with they come in these things. So it's basically done in such women. Now coming to what measures are taken at preconceptional level for risk assessment. So the aim is mainly to identify high risk cases by the terms of personal history, clinical examination, karyotyping, genetic screening. Then knowing the base health level, health status of a woman before she's going into pregnancy, giving her rubella, hepatitis immunization, or any active vaccines even before she conceives, giving folic acid supplementation 4 mg per day, which is starting 4 weeks prior to conception and continuing it up to 12 weeks of pregnancy. Then maternal health is optimized preconceptionally. Fear of incoming pregnancy is removed. Patient with any medical complication should be educated about effects of the disease on pregnancy. So how is the disease going to affect chances of conception and pregnancy? Now pregnancy in turn affects the disease, and all the drugs used before pregnancy have to be evaluated and have to be marked as like okay or not, and then you decide what you want to do, because ultimately even though placenta acts as a barrier, all drugs will cross through the placenta. So drugs like warfarin is maybe stopped, then we should advise her to stop smoking, to quit smoking, alcohol. We should help her in case she is addicted and give her bupropion patches. Then any inheritable genetic diseases have to be screened, and if there's a risk of passing on, they can use maybe donor sperms and eggs. Then go for then emphasis on prenatal importance of prenatal diagnosis of diseases. Inheritable diseases are eliminated by primary prevention, secondary prevention. Then those who have recurrent loss have to be examined very thoroughly. Then education classes where they discuss about the modes of delivery, timing, what is to be preferred, is to be done. But unfortunately, very small women undergo preconceptional counseling and care because of lack of public awareness, and many pregnancies are unplanned. So this is why it has not been a very safe, or not a safe, but it's not been a very successful measure.